When you think about a major surgery, you probably picture the drama of the operating room, right? But for GI surgeons, the real nail-biting, the part that keeps them up at night, actually starts after the patient leaves the OR. So today, let's pull back the curtain on the 10 complications that surgeons truly fear.
You'll hear surgeons say this all the time, and it's the absolute truth. The technical performance, the perfect stitches, that's just the first half. The real victory, the success of the whole thing, is decided in that fragile first week. That's when you really find out if it worked.
And that's why they have a name for them, nightmare complications. And it's the perfect name, because these aren't about a surgeon making a mistake. Nope. You can have a flawless, by-the-book operation, and one of these monsters can still rear its head. They are the terrifying wild cards of recovery.
All right, so to make sense of this, we're going to split them into two groups, just like surgeons do in their heads. First up, the big ones, the 5 lethal complications. These are the events that can threaten a patient's life, and fast.
Okay, this is the undisputed heavyweight champion of surgical fears, an anastomotic leak. Picture it. A surgeon has just carefully reconnected 2 ends of the intestine. A leak is when that seam, that connection, fails. It breaks open, and all the toxic stuff inside the bowel spills out into the abdomen. It is every GI surgeon's worst nightmare.
So why would it fail? Well, you have to think of healing as a construction project. It needs a few things to go right. It needs a good blood supply. That's the delivery of materials. It can't have any tension pulling it apart. The site has to be clean, no infection. And the patient needs good nutrition to fuel the whole process. If you're missing any one of those, the whole thing can just fall apart.
And this number right here, this is why it's so feared. We're talking about a mortality rate that can climb as high as 20 to 30%. A major leak sets off a devastating chain reaction, massive infection, sepsis, and then total organ failure. The stakes just don't get any higher. Next up is post-operative hemorrhage, or massive bleeding. What makes this one so incredibly dangerous is that it can be completely silent. You see, bleeding inside the abdomen isn't like a cut on your arm. It's hidden. A patient can be losing a catastrophic amount of blood, and the first clue might be when they suddenly go into shock.
So we've had a leak, we've had a bleed. Now let's talk about an overwhelming infection, sepsis. This is when your body's response to an infection goes into overdrive and starts shutting down your organs. In GI surgery, it's usually kicked off by something like a leak, flooding the abdomen with bacteria like E. coli. It's an absolute internal crisis.
This next one is a bolt from the blue, a pulmonary embolism. A patient can be recovering perfectly, walking the halls, feeling better every day, and then, suddenly, they collapse. What happened? A blood clot, usually formed way down in the legs, broke loose, traveled to the lungs, and instantly blocked off blood flow. It's a terrifying cause of sudden death after surgery.
So why is surgery such a prime time for clots? Well, it creates what's known as Virchow's triad, basically the perfect storm. The stress of surgery makes your blood thicker and more likely to clot. Lying in bed makes your blood flow slower. And the operation itself can damage blood vessels. You put those 3 things together, and you have a recipe for disaster. And our final lethal complication is the pancreatic fistula. See, the pancreas makes these incredibly potent digestive juices. Their job is to dissolve food. But if those juices leak out after surgery, well, they don't know the difference between a piece of steak and your own organs. They can literally start to digest nearby tissues and blood vessels, causing absolute catastrophe.
Okay, that's the 5 that can kill you. But there's a whole other category of complications that surgeons worry about. These next 5 are called disabling. They might not be as immediately fatal, but they can completely and permanently change a person's life for the worse. A bile duct injury is just devastating, particularly because it often happens during one of the most routine operations there is, gallbladder removal. One accidental nick to this critical little tube, and you've got bile leaking everywhere, causing liver damage, and almost always needing another massive, high-risk surgery to try and fix it.
You can think of this one as the ghost of surgery past. Years, sometimes decades after an operation, the body can form these internal scar tissue bands called adhesions. And one day, one of those bands can trap or kink the bowel, causing a dangerous blockage that sends you right back to the operating room.
Now, sometimes the bowel gets blocked without anything actually blocking it. It's called an ileus. Basically, after being handled in surgery, the intestines can just get stunned, and they temporarily stop working. It's a functional paralysis. The road is clear, but all the traffic is stopped, causing a major backup.
You know, the pancreas is a really sensitive organ. It does not like to be disturbed.
So if you're doing surgery on something right next to it, like the stomach, just the stress of being handled can cause it to become severely inflamed. This is incredibly painful, and in the worst cases, parts of the pancreas can actually start to die off.
And our final disabling complication isn't really a mistake, but the direct result of a life-saving surgery. If a huge part of the small intestine has to be removed, the body loses its ability to absorb nutrients. The result is short bowel syndrome, a lifetime of malnutrition and chronic diarrhea, often meaning the person has to be fed through an IV forever.
So with all these potential disasters lurking, how do surgeons possibly manage the risk? Well, it comes down to being on high alert during one very specific, very critical period.
This is it. This is the magic window post-op days 3 to 7. Why then? Well, that's when the body's initial massive inflammatory response to the surgery starts to calm down. And it's in that quiet period that the real problems, the leaks, the infections, tend to show themselves. For a surgeon, these few days are the most stressful part of the entire job.
So how do they keep all of this organized in their heads? They use a dead simple mental framework, the one you're looking at right now. 5 plus 5. 5 that are lethal, 5 that are disabling. This is the checklist they run through day after day during that critical post-op window.
In the end, every single surgery is this incredible tightrope walk between risk and reward. And learning about these nightmare scenarios doesn't take away from the miracles of modern surgery. If anything, it should give us a much deeper appreciation for what a monumental achievement a smooth recovery really is, and for the incredible skill and vigilance it takes to get there.